Ever wondered what happens when a blood transfusion doesn't go as planned? This is where transfusion reactions come into play, a serious and potentially life-threatening complication of transfusion therapy. These reactions are rare but significant and can range from mild symptoms to severe and even fatal outcomes. They can be classified into three types: immunologic, non-immunologic, and infectious, each with their own unique mechanisms and clinical presentations. Now, let's delve deeper into each of these reactions. Immunologic reactions are the most common type of transfusion reactions. These occur when the patient's immune system reacts against antigens in the donor's blood. Let's break down the different types of immunologic reactions. First up, we have hemolytic reactions. These are the most severe kind, and they're characterized by the destruction of red blood cells. This leads to a process called hemolysis, which can cause intravascular hemolysis and systemic inflammation. In simpler terms, the patient's body is reacting to the transfused blood and breaking down the red blood cells, which can lead to serious complications. Next, we have non-hemolytic reactions. These include allergic and anaphylactic reactions. They're caused by the recipient's immune response to antigens in the donor's blood. Symptoms can range from mild, like itching and hives, to severe, such as difficulty breathing and a drop in blood pressure. Lastly, we have febrile reactions. These are caused by the release of cytokines, which are small proteins that play a key role in cell signaling. Febrile reactions are characterized by fever, chills, and rigors. In layman's terms, the patient's body is responding to the transfusion with an inflammatory response, leading to fever and chills. While these immunologic reactions can be serious, it's important to remember that they are just one piece of the puzzle. There are other types of transfusion reactions we need to be aware of. Immunologic reactions can be serious, but they're not the only type of transfusion reactions we need to be aware of. Non-immunologic reactions are less common but equally important. As we delve into the world of non-immunologic transfusion reactions, we encounter three primary types: transfusion-related acute lung injury or TRALI, transfusion-associated circulatory overload known as TACO, and transfusion-associated immunomodulation or TRIM. Let's start with TRALI. This is a form of acute respiratory distress syndrome that typically occurs within 6 hours of a blood transfusion. The cause? It's believed to be due to the infusion of donor antibodies into the recipient. The result can be severe, leading to respiratory distress and even lung injury. Next up is TACO. This happens when the volume of blood transfused exceeds the recipient's circulatory capacity. In simple terms, it's like trying to pour a gallon of water into a pint glass. It just doesn't fit. This overload can lead to pulmonary edema and congestive heart failure. Finally, we have TRIM. This is a complex immunologic process associated with increased susceptibility to infection and adverse clinical outcomes in transfusion recipients. Essentially, it's like the body's immune system gets a bit confused and starts behaving differently, which can have a range of effects. Each of these reactions has different causes, characteristics, and potential outcomes, but all are important to understand in the realm of transfusion medicine. Now that we've covered non-immunologic reactions, let's move on to infectious reactions. Infectious reactions can occur when a transfusion transmits pathogens. This means that bacteria, viruses, or parasites from the donor's blood can cause diseases in the recipient. Some of these diseases include bacterial sepsis, hepatitis, human immunodeficiency virus or HIV infection, and even malaria. These reactions can have serious, sometimes life-threatening consequences. But here's the good news. The risk of infectious transfusion reactions has been significantly reduced. How, you ask? Through stringent donor screening and testing protocols, along with the use of pathogen inactivation technologies. These steps ensure that the blood being transfused is as safe as possible. Understanding the different types of transfusion reactions is crucial for recognizing and managing these complications. To wrap up, let's summarize the key points about transfusion reactions. These adverse events can be immunologic, non-immunologic, or infectious in nature. Immunologic reactions, the most common, are due to the recipient's immune system reacting to the donor's blood antigens. Non-immunologic reactions can be caused by factors such as transfusion-related acute lung injury, circulatory overload, or immunomodulation. Infectious reactions occur when the transfusion transmits pathogens from the donor to the recipient. The severity and type of these reactions can vary greatly, from mild symptoms to severe outcomes. Prompt recognition and management are crucial to mitigate risks and improve patient outcomes. Remember, knowledge is power, especially when it comes to patient safety and outcomes.